My name is Mark Hallett. We're at the Movement Disorder Society in Dublin in June 2012, 2 days after Bloomsday. And I have the pleasure of interviewing Dr. Joseph Jankovic, who's a past president of the Movement Disorder Society. And he's going to tell us about his career in movement disorders. And Joe, I'd like to start by telling us about your early life. I know you weren't born in the United States. Tell us about how you came to the United States and how you got interested in medicine.
Well, first, let me say that I'm honored to be interviewed by you, Mark, because I consider you not only a colleague, but one of my closest friends. So I'm honored to be interviewed by you. As far as my early development, maybe I should start it. I was born on March 1st, 1948, 2 hours after February 29th, which was a leap day. Otherwise I would have been celebrating my 16th birthday. I was born in Czechoslovakia in a small town called Teplice. And at that time, my mother was employed. My father was recovering, what we thought was recovering from TB, but unfortunately he died when I was 2 years old as a consequence of tuberculosis. My mother then remarried a few years later. We moved to a small town called Litvinov, which is just north of Prague. And that's where I spent my early childhood. I was eventually accepted to a fairly prestigious science high school. But when I was 17 years old, my uncle in California invited me for vacation. I was going to spend only 2 weeks in the United States, but after a few days, it became apparent that I should start thinking about my future. And after talking to a number of my friends and relatives, they convinced me that my future was not going to be in Czechoslovakia, but in the United States.
Mm-hmm. How was your English at those times?
So I spoke no English. The only thing I could say, hello, my name is Joe. It was a very, very difficult decision when I finally reached a decision to stay in the United States. I was adopted by a distant family in Phoenix, Arizona, the Spitz family. And the deal was that they would help me get educated, and I would in turn look after their 4 children. So obviously this was the most difficult decision in my life when I decided to stay in the United States. At that time, my mother was waiting actually at the airport for me to return from the United States. And obviously I was not on the plane that she came to the airport to welcome me. For several years, in fact, I had this fear that I will never see my mother and my stepfather, my half-brother again. Nevertheless, through these early days, I learned to gradually adopt, obviously figured out that I have to learn the language, and graduated from high school in 1 year, and then finished my college education in 3 years. And since I was living in Phoenix, Arizona, and had essentially no funds, I applied to only one medical school at the University of Arizona College of Medicine, and fortunately was accepted. And I graduated from the University of Arizona College of Medicine in 1973.
So how did you get interested in medicine as opposed to some other field?
I was always interested in medicine, even through my childhood. I went to science high school. My mother was in a nursing type situation. My stepfather was a sort of a druggist or pharmacist. And I was surrounded by physicians and children of physicians. So I was always interested in medicine, but frankly, I didn't think that I was going to be actually able to pursue medicine in Czechoslovakia because of my Jewish background. I knew that it would be very difficult for me to be accepted to medical school in Czechoslovakia. So that was certainly one of the main reasons why I decided to stay in the United States.
So I understand about medicine. How about neurology? How did you get interested in the brain?
Well, when I was in medical school, many of the faculty at UM's Arizona College of Medicine were actually retired Harvard professors who would come to Tucson to sort of retire, and instead of just doing research, they pursued teaching. So I was the beneficiary of their teaching abilities. And one of the professors, his name was Jay Angevin, who you may know since your background is from Harvard, who actually wrote a mouse atlas, brain mouse atlas. And he had a very unique way of teaching. For example, he would talk to us about the cerebral peduncles and showed us how the cerebral peduncles cross, and was very animated in his way of teaching. And I got inspired and interested in brain, initially brain anatomy, and then eventually neurology.
Very interesting, because he also taught me anatomy. You're absolutely right. He was an absolutely spectacular teacher, and I can see how he could get you in that particular direction. So you got interested in neurology, and then so how did you proceed after medical school?
Well, so in my last year of medical school, I was able to do a 6-month rotation at the Neurological Institute at Columbia. Initially, I was interested in pediatric neurology. I love children, and I thought that pediatric neurology was in my future. But when I learned that I have to do neonatology, which I didn't like at all, I abandoned the idea of being a pediatrician or pediatric neurologist and focused more on adult neurology. While I was at the Neurological Institute, I met Sidney Carter, who was one of my mentors, and as you know, he's the founder of pediatric neurology. Met Houston Merritt and all these giants in neurology, and so I was very fortunate to be accepted to the residency program at the Neurological Institute. I first did my internship at Baylor College of Medicine between 1973 and 1974. In 1974, I then transitioned to the Neurological Institute at Columbia and eventually became Bud Rowland's first chief resident when he returned from University of Pennsylvania in the early 70s. So the experience at the Neurological Institute obviously was life-changing for me.
Right, but there's obviously something more about that particular experience. It molded your career for the rest of your life, and you haven't mentioned that yet.
Right. So I always considered Bud Rowland as one of my earlier mentors. And during the residency, he was trying to convince me that my future in neurology was neuromuscular diseases, which was his specialty. But soon after I arrived to the Neurological Institute, I met Stan Fahn and started to shadow him wherever he would go, and got infected by his enthusiasm for movement disorders. Eventually, I actually established the movement disorder conference, which is still held in the Neurological Institute on Tuesday afternoons, so nothing has changed. And I attended the movement disorder clinic, and eventually, during my chief residency, I devoted much of my time actually following Dr. Fahn. So I had a sort of a dual duty as a chief resident and also as a sort of a fellow. I always tell him that I was his first unpaid fellow. Bob Berg, who followed me, became his first paid fellow.
So those were the very early days in movement disorders. In fact, there really wasn't a formal field of movement disorders at that time. Stan was one of the pioneers, and as one of his first unpaid fellows, you were also in that. What was the field like at that time? What was the practice of movement disorders like when you were in your training?
Well, that was the sort of beginning of movement disorders, as you mentioned. The field just began to evolve largely as a result of collaboration between Stan Fahn and David Marsden, who I consider also a close friend and a mentor. The emphasis at the time was more on phenomenology, how to define the different disorders by their clinical symptoms and signs. And I found it very intriguing and exciting because I began to appreciate the power of observation and how important it is to observe the patient and learn how to differentiate the different movement disorders. In fact, I remembered when I had to meet with Dr. Rowland to tell him that I changed my mind. I'm not going to muscle, but I'm going to go into Parkinson's disease. He looks at me and said, Parkinson's disease? You made the diagnosis in the first minute. What are you going to do for the rest of the hour? So this was a typical Bud Rowland comment, and but fortunately he was very supportive of my decision. And originally I was going to stay at Columbia, but eventually got an offer that I couldn't refuse at Baylor. So in 1977, I transitioned to Baylor College of Medicine.
Let me go back to one other thing that you mentioned. Again, thinking about the early days of movement disorders and what movement disorders was really like at that time. You mentioned Parkinson's disease. I mean, Bud mentioned Parkinson's disease. And the question is, at those very earliest days, what was the emphasis in movement disorders? Was it entirely Parkinson's disease? I have the sense that it was largely basal ganglia disease, but Parkinson's clearly was important at that time. So what was the sort of range that people were really thinking about in terms of movement disorders?
Well, it's a very important point because the concept of movement disorders really didn't exist at that time. I still remember trying to find a patient for a movement disorder conference that I mentioned earlier, and I went on the third floor of the Neurological Institute and asked one of the residents, who happened to be actually a medicine resident rotating through neurology, and I asked him, do you have any patients with movement disorders that I can present at our conference this afternoon? And he looks at me and says, yeah, there's this lady in that corner there. She has been constipated for months. And so that was his concept of movement disorders. He was thinking in terms of bowel movements. But I think as a result of the publications initially by David and Stan, the concept of movement disorders became more accepted. It was not just focusing on Parkinson's disease, or at that time the term extrapyramidal syndrome, but it began to include not only Parkinsonian disorders, but also hyperkinetic movement disorder, which eventually became one of my passions.
So tell us about videotapes. Were they common at that point, or when did they begin to be part of the meetings and things of that sort?
Well, at that time there were no videotapes, there were films, and I still remembered using Super 8 films and splicing it, gluing it together when I was editing those films. So the technology obviously was not there, but we recognized early on that it was important to capture and document the phenomenology so that we can later on discuss it and come to some collective consensus about what the phenomenology was. So we used to have these rounds actually at Stan Fahn's house where a number of people would come, including Oliver Zacks and other people, and we would often argue based on the view of these films what the phenomenology was, and that really helped me crystallize in my own mind the differences in these various hyperkinetic movement disorders and how important the phenomenology was.
I see. So there were not only weekly meetings in the hospital, but there was also meetings at Stan's house.
Yeah, so we used to have these journal clubs where basically we reviewed films of patients that we taped over the last weeks or months, and then we would argue about the phenomenology.
Mm-hmm. And was there any liquid refreshment in those?
There always was.
That always helps discussion.
Right, and some of those conferences went very late, which actually started this tradition that you, I'm sure, are aware of, this concept of unusual movement disorders at the American Academy of Neurology. And I was fortunate to participate in the early conferences, and many of these conferences were scheduled, I think, from 7 to 10, but we would often go till 1 or 2 2 o'clock in the morning with David Marsden, Stan Fahn, and a number of other people discussing these cases. And I think these unusual movement disorder conferences infected other people with enthusiasm and passion for movement disorders.
Yes, no, clearly I think that was one of the things that grew the field, those particular conferences.
Yes.
All right, well, in terms of chronology, you're just off to Baylor with that very nice offer that you got and couldn't refuse. Tell us what it was like when you arrived and how things went in the early days there.
So I was recruited by Dr. Stan Appel, who at that time was the chief of Division of Neurology at Duke, and he became, I think, the youngest chief of neurology when he was recruited by Dr. DeBakey to come to Baylor. And I must say I was quite anxious at that time. I accepted the offer with trepidation because I didn't know much about being on a faculty, and I just finished my chief residency, didn't have really much experience as faculty. But it was a very interesting beginning, and I learned very quickly that I really have to depend on myself and no one else. I still remember sending out a letter to all the neurologists in Texas telling them, I just came here from Columbia, trained with Dr. Pham, please send me all your Parkinson and movement disorder patients. And what I got out of the letter was nothing, no response. And that was actually a very good lesson for me, because I learned that in order for me to start studies, clinical research, clinical trials, I have to develop my own population of patients. So I would take calls for everybody in the department and really build up first general neurology practice and eventually the movement disorder practice, which enabled me to start clinical trials.
So your whole career basically has been there. You've done very well. Perhaps you could give us a little more information about how things developed there over the years. You told us about the beginning. You've been very successful. Tell us about all the things that you did and perhaps whether there's any lessons there for other people in terms of other young folks beginning their own careers.
Right. So on one hand, the beginning was clearly difficult for me. On the other hand, looking back, it may have been somewhat, I guess, easier than it is for young investigators today. I remember some of the earlier publications were based on relatively small clinical trials. I, for example, did one of the first clinical trials in pergolide, double-blind control study, but it was a very small sample, and admittedly, that kind of small clinical trial probably would not be accepted for publication today. Today, young investigators are in a somewhat more difficult situation, because in order for them to participate in clinical trials, they have to be part of a consortium. It's very hard for individual young investigator to initiate and complete clinical trials. So in order for them to be involved, they have to be usually part of a consortium. So it's hard for a young investigator, I think, to make a name for himself or herself. But my early publications were based not only on clinical trials, but clinical observations. I have been very interested, again, in the phenomenology and trying to refine the phenomenology of movement disorders. And even within Parkinson's disease, I was actually the first one to coin the term PIGD, partial instability gait difficulty form of Parkinson, which was frequently cited today at our Movement Disorder Congress. And we did some of the initial studies to determine, what are the subtypes of Parkinson's disease. So we determined that there are two major subtypes: the tremor-dominant form of Parkinson's disease, which has a much slower progression, more favorable prognosis, versus the PIGD form of Parkinson, which progressed more rapidly, was less responsive to dopaminergic drugs, was more frequently associated with cognitive decline. So these observations are now taken for granted now. Everybody, I think, recognizes those two subtypes of Parkinson's disease, but in the early days, that was a novel concept, that there are different subtypes of Parkinson's disease.
So how did you go about doing that? Did you have some sort of database that you kept that you could sort of look back at, or was it just sort of an observation that you made prospectively, seeing patient after patient and beginning to figure out that there were these two different groups?
So one of the best decisions I think I made early on when I came to Baylor is to start a database. So every patient who came to our clinic was entered into this database, and this evolved into a huge population of patients that were well characterized. We now have over 35,000 patients in that database. And subsequent research was focused largely on data mining of this database. And also I made a decision early on that every patient, particularly with hyperkinetic movement disorder, should be videotaped. And I now have a video library that has about 15,000 patients, so I probably have a video of just about every movement disorder there is. My wife Kathy has been very, very helpful in editing those videotapes, and so we have a huge library that I keep at home. We initially bought editing equipment. I still remember I paid $54,000 for that editing equipment. You can now buy it for less than $2,000 in a little laptop. So those were the early days, and but I think the investment has paid off, and using these videotapes in my educational materials and developing video atlases clearly has been very helpful, having this large video database.
So you just mentioned Kathy. Tell us about her.
I'm going to try not to cry because, because you know how I feel about Kathy. So after deciding to stay in the United States, the second most important decision in my life was to marry Kathy, and she has been very supportive, of course, over the years. And we've been very fortunate because we have had a wonderful, wonderful marriage and a lot of life experiences that really enriched our life. And certainly the most important was our three sons. Zachary is the youngest one, Daniel the middle one, and Jason the oldest one. And we are very, very proud of their accomplishments, and also all of them are in stable relationships. Jason is married, and Daniel is married. I now have 5 grandchildren. That's why I'm dyeing my hair gray, so I look like a grandfather. I would say of all the accomplishments in my life, that I consider my number one accomplishment, the fact that I have just a very supportive, loving wife and family, and so it has been a rewarding experience, certainly personally.
Right, so for all the listeners to the interview, I can verify that family for you is number one.
Absolutely.
Neurology number 2.
Right. In fact,
so
you mentioned that I've stayed in Baylor now for 35 years, and clearly the most important reason has been the importance of stability in my personal life. And over the years, as you can imagine, I had a number of offers to chair departments and various other opportunities. In fact, I have a folder at home called Missed Opportunities, and it's a fairly thick folder, but I have no regrets. But every time I would discuss the possibility of accepting another position elsewhere with my children and Kathy, it became obvious that they enjoyed living in Houston. They had their network of friends, and moving would be quite disruptive to our family life.
So Kathy also, though, was clearly helping you with the research. She got involved with the videotaping. Was that relatively early on then that she began helping you in that regard as well?
Yes, so as you know, one of my passions is film, and we have always been interested in film. Two of my sons actually are in film industry. They have their own film companies, and Kathy, has been very interested in film, and even in the days when I was still a resident in the Neurological Institute, we were already filming. We made the only documentary actually of the Neurological Institute starring Houston Merritt. And this was in the days of Super 8 film. But when we moved to Houston, Kathy continued to be very helpful and supportive of this video library. And as I said, it evolved into a huge video database.
So tell us what you think your major scientific contributions have been. You've already mentioned one in terms of categorizing Parkinson's disease, which is obviously very important and continuing to be important. But are there other things that you're particularly proud of in terms of scientific accomplishments?
I think most people probably would consider me as sort of a pioneer and perhaps even a leader in the field of hyperkinetic movement disorders. And within hyperkinetic movement disorders, I think what I'm most proud of is the very early development of botulinum toxin. I conducted the first double-blind placebo-controlled trial, the results of which were presented to the FDA and eventually resulted in FDA approval of Botox as the first form of botulinum toxin. So I'm very proud of that, and I continue to be, very interested and involved with botulinum toxin. As you know, I've been part of the Neurotoxin Institute. Was one of the co-founders of the Neurotoxin Institute, and together with you and Albert Albanese, we recently formed the International Neurotoxin Association, and so I continue to be very involved in botulinum toxin research, published a number of books, one of them with you on botulinum toxin. Actually, two of them, I think, were with you. So I consider that my probably most important accomplishment. And I suppose the second most important accomplishment has been the development of tetrabenazine for the treatment of hyperkinetic movement disorders. As you know, tetrabenazine acts as a presynaptic dopamine depleting drug, and as such had the advantage over the postsynaptic dopamine receptor blocking drugs in that it does not cause tardive dyskinesia. So until the advent of tetrabenazine, most of the hyperkinetic movement disorders were treated with neuroleptics, Haldol and Thorazine and these kind of postsynaptic dopamine receptor blocking drugs. And these drugs, unfortunately, can cause a variety of side effects, including tardive dyskinesia. So I became interested in tetrabenazine even when I was still at the Neurological Institute. And when I moved to Baylor, I approached Hoffman LaRoche and suggested at the time that they may consider using tetrabenazine in conjunction with the neuroleptics to prevent the development of tardive dyskinesia. That didn't get funded, but they did allow me to access their file, and I received my IND from the FDA in 1979 for tetrabenazine. And since that time, I've treated thousands and thousands of patients with a variety of hyperkinetic movement disorders and published a number of clinical trials on tetrabenazine in tardive dyskinesia, in Huntington disease, and other hyperkinetic movement disorders.
Since there's such an interest in botulinum toxin, maybe just step back a moment and tell us how you got interested in botulinum toxin, how you heard about it, how did the first trials come about. That's an interesting story also.
So I remember reading about the work of Alan Scott, who was the director of the Smith Kettlewell Eye Research Institute in San Francisco. He's a pediatric ophthalmologist who was interested in strabismus, and he was using a monkey model to correct the abnormal eye movements. And I remembered calling him one day and say, "Have you tried it in this condition called blepharospasm?" Being a pediatric ophthalmologist, I don't think he ever actually saw a patient with blepharospasm, but I happened to have a patient in San Francisco with blepharospasm, and he tried it, and the rest is history. It was obviously extremely effective. I then went to Smith Kettlewell and spent some time with him trying to develop the best technique for the treatment of blepharospasm with botulinum toxin. And eventually we applied it also for other focal dystonias, including oromandibular dystonia and cervical dystonia, and conducted the first clinical trial in blepharospasm and cranial cervical dystonia. In fact, that trial was initially funded partly by the Blepharospasm Research Foundation, and I'm very proud of the fact that I was the first chairman of the scientific advisory board of the Blepharospasm Research Advisory Board, and I know you are the current chairman, so you continue all the success of the initial efforts by Marilu Koster, who was the founder of the foundation.
So one of the questions that is sort of standard for these interviews is to talk about heroes. I think you've already given us some sense of the people that were very important in your life. Is there anyone that you also might want to comment about? And is there anyone else who...
Well, I mentioned you. You are certainly one of my heroes. I mentioned Bud Rowland and Stan Fahn, but one person we have not talked about who has had a tremendous influence in my life, as I know in your life, is David Marsden. I met David sometime in the actually 1970s when I was still was a resident. He used to come to the Neurological Institute. He already began his collaboration with Stan Fahn, and I was very, very impressed with his power of observation, his eloquence, his charm, and obviously his high level of intelligence. That I try to emulate, but I will never even come close to that. But he clearly was one of my early heroes, and as you well know, we eventually started to discuss how we can further educate physicians about movement disorders, and started the Aspen course in 1990. We are now in 22nd year, consecutive years of what is known as the Aspen course, which is really a comprehensive course on Parkinson's disease and movement disorders. And two books came out of that course. One of them you co-authored with Stan Fahn and myself. And as you well know, David played a very important instrumental role in the development of that course. Unfortunately, as a result of his untimely death 10 years after the initiation of the course in year 2000, we then asked you and Peter Jenner to help us out. It took two people to substitute for David, and you've done a spectacular job in helping us develop the course further. And now it's just the three of us, you and Stan and me. And as I said, this is going to be our 22nd year.
So in terms of that course, I always have the feeling that the most important population that comes are the fellows. There's a number of people that come, but the fellows, I think, are the most important. Would you agree with that?
Absolutely. And you asked me what I consider some of my accomplishments. One of the major accomplishments that I'm proud of is not only training my own fellows, and over the years I've trained close to 100 fellows that are now spread out throughout the world. Many of them have become leaders in the field of movement disorders, like Mark Stacy and Chico Cardoso in Brazil, and Ike Tan in Singapore. These are just some of my fellows that I think most people now would consider leaders in the field. But I'm also proud of the training that all of us have done together of fellows that come to Aspen. As you know, we've been able to fund anywhere from, I think, 15 to 25 fellows every year that we would provide a stipend for their directors, who then were able to fund their participation in the Aspen course. And that has been obviously a very rewarding experience. And even today, many of the leaders in the field of movement disorders often say that they got their start in Aspen. So I'm very, very proud of that.
One of the other things that you're very good at is writing. You have written a large number of papers, you've edited a large number of books, written lots of chapters. Is there any advice that you could give younger people again on, publish or perish? And you're obviously know how to do it. What sort of advice would you give them in that regard? How can they do better in that area?
It's a very difficult question. I must say I enjoy writing, so I think that helps. I find it actually quite relaxing, and I have written over 800 articles and chapters and about 40, 50 books, and I enjoyed every project that I did, and in the more recent time, the fellows are usually the ones who drive these projects, and I'm their mentor, and I help them, write it. I'm always amazed how frequently I find people who are otherwise extremely bright, but for some reason they cannot convey their ideas in writing. So I think that one almost has to have, a sort of a special gift for writing. It's not something that one can learn, although in my early days I definitely learned a lot from, for example, Dr. Rowland. I remember the very first manuscript that I wrote, I asked him if he could review it for me, and it came back all in red. That's at that time. That's how he edited the manuscripts, and it was a very humbling experience for me, and I learned a lot from it. And over the early years, I frequently would ask Bud to review my manuscripts, and I learned so much from that. So mentorship is clearly important in writing. Although sometimes just having an innate skill for that does help.
Well, probably even later on when you send something to Bud Rowland, it would still come back in red.
Yes, and I'm still learning from him. Absolutely, yeah.
Okay, so tell us about the Movement Disorder Society. What sort of role have you played in it, and what sort of role do you think that it's played in the sort of general movement disorder area?
So in the early days of this movement disorder movement, it was not called a society, number of us had discussions about how we can bring everyone interested in the field together. And this culminated in a meeting that we had in September 1985 in Hamburg, Germany, during World Federation of Neurology Congress. And I remembered meeting in the hotel room, and there was, at that time, it was David Marsden, of course, Stan Fond, Andy Lees, Eduardo Tolosa. I hope I didn't leave anyone out, and myself. And we were brainstorming at the time, how to start the organization. I remember at one point, actually, Kathy came in and took a picture of us, and that has become frequently publicized picture for the Movement Disorder Society, because that was sort of the beginning of the society. And as you know, Stan Farm became the first president, David Marsden the second president. I was honored to be elected as the third president. At that time, we had very little infrastructure. We had essentially no money. So it was difficult. I didn't have the secretariat staff that the society has now. Everything was done by snail mail, not by email. So the early days were challenging, but obviously it has paid off, and I'm so proud of what the Movement Disorder Society has accomplished. And in this Congress here in Dublin, 16th International Congress, I understand there's over 5,000 participants from well over 100 countries, and I think that speaks for itself how successful the organization has been.
So in terms of advice to younger people, we've talked a little bit about that, but are there any other lessons or things that you'd like to convey to them as they're starting out in their career in movement disorders? Is there any particular opportunities that you see that that they might have that maybe you and I didn't have, or what sort of things should they be thinking about as they're embarking in this same line that you did?
Right. Well, I remember counseling many of my residents in the early days, and I would often tell them, that they should strive to become physician scientists, that they should have one foot in the clinic, one foot in the lab. And this was sort of a noble concept that I never achieved, but I thought that other people should aspire to. But I must say that over the last few years, I have changed my mind about it, because the world has become extremely competitive. And for a physician scientist, even MD, PhD, to compete with just somebody who spends 100% of their time in the lab, a PhD, I think is becoming almost unrealistic. And I have seen, unfortunately, a number of very, very bright people with MD, PhDs who have not succeeded. One, they are not respected by the clinicians because the clinicians think that they spend way too much time in the lab. And frankly, they are often not successful in getting their grants because the people who review the grants are pure basic scientists. So I must say, over the last few years, I have advised some of the junior people to start focusing more and make a decision. I remember when I was in my second year of residency, this was actually one of the more difficult decisions I had to make, because I loved clinical neurology, of course, but I also liked basic science. And I knew at that time, that was one of the smartest things I did. I recognized my limitations, and I knew that I could not do both successfully. And I had to choose one or the other. And I did not want to depend on soft money for the rest of my life, writing grants. So I figured, even if I don't succeed as a researcher, I will still have clinical practice. And therefore, I chose the clinical route. I have become sort of clinical researcher, but now I have a cake and eat it too, because I do mostly clinical research, but I do have a basic science group that I interact with, and I think I learn more from them than they are learning from me. But nevertheless, it's a very fruitful collaboration. And many of my papers actually span translational research, for example, into genetics and other sort of basic science type topics. So I would tell the young investigators, first, make a decision, but keep your options open. But you're going to have to focus early on, either clinical or basic science. Get the best possible mentor that you can find. And start writing grants as early as possible, and supplement the grants as much as you can by philanthropy. I strongly believe that philanthropy is extremely important to the success of either clinical investigator or basic science investigator.
Recently, your son won an award from the American Academy of Neurology. Do you want to tell us about that?
Yes, I'm very proud of Zach. He's a filmmaker, and he became interested in the story of one of my patients, who's an astronaut who flew on 3 space missions. He was diagnosed by me with early Parkinson's disease, and became a spokesperson eventually for Parkinson's disease. And Zach became interested in that story and decided to do a documentary, and he submitted recently a 5-minute segment of the documentary to the American Academy of Neurology Neurofilm Festival, and I'm proud to say that he won the first grand prize. When he accepted the award, he thanked the Academy and said, "This is the first Academy Award I received," and so I'm very, very proud of him.
I think the message of your last comment is that whatever you choose, you should do it well, and that seems to be the message, that you can't be too spread out, that when you choose something, you really should make sure that you're doing it the best.
Absolutely. I think you need to select your field and then focus on the area that you think has the best promise, and strive for excellence. If you ask my children what is my very favorite word, they will undoubtedly say anticipation, because I think anticipating the future is absolutely key to success. So if you can anticipate where you're going to be, not tomorrow or next day, next week, but 10 years from now, that I think will determine your success.
So that leads into the next question that I was thinking about. And in your own career, as you said, what you focused on in the beginning was phenomenology, clinical trials. What are the things that you would recommend perhaps to younger people now in the field? Is that the same areas or different ones?
Well, I think that depends what field they select. So if they select a clinical path and they want to become clinical researchers, I would strongly advise them to get background in biostatistics, in trial design. I think those are essential elements in success when you are a clinician or clinical researcher. Of course, if you are a basic scientist, then obviously you need to get the best mentor to teach you the basic science techniques. So I think that would be my advice to the clinical researchers. But even if you become a clinical researcher focused on one particular area, don't lose the track of vision for all the movement disorders. I personally find all the movement disorders exciting, and I'm proud of the fact that I'm considered a generalist in terms of movement disorders. My area of interest spans not just Parkinson, but just about every hyperkinetic movement disorder, and I'm quite proud of that, and I enjoy that. But many movement disorder experts tend to focus on just a very narrow field, and sometimes they miss the broad vision and the general picture of movement disorders, because every aspect of movement disorder to me is very exciting.
Well, Joe, thank you very much for being so candid with us and telling us all the information about your own career and giving advice to young people. You've been one of the pioneers and leaders, and I think it's very clear from what you've told us now why that's the case. So many thanks, congratulations, and we look forward to many more years of working together.
Well, thank you very much. And let me again say what an honor it is to be your colleague and especially your friend.